The job report that came out on Friday says the economy is strong. So why does it feel like people, everyday people, are just getting by? This is the Real Frontline. I'm Richard Fowler, and we're giving you context, and we really don't have time for chaos. So let's get into this one. The job numbers came out Friday, this past Friday, and the unemployment numbers were 4%. So let's just dig into the weeds. I'll give you the top lines and I'll break them all down. So the non-farm payroll rose, adjusted 178,000 jobs for March. And there were revisions made. It was 133 job decline for February, better than expected. That brought the unemployment number down to about 1.4%, or roughly 4%. Wages rose less than expected. And there's a couple of things that this job report points out to us. One is likely that the feds will hold interest rates the same. The video tomorrow will be about interest rates, so don't you worry your little head, because I'm going to tell you about interest rates. So stay right there. Subscribe and like this video. Stay around. I'll tell you about interest rates. Now, let's dig into this jobs report because I think it's really important. Healthcare, hospitals, nursing homes, home health aides, doctors' offices were responsible for much of the growth in this jobs report. 76,000 jobs were added in healthcare. There was also a strike. Kaiser Permanente workers in January and February in California and Hawaii were on strike. That is why we saw a dip in the unemployment numbers. And so they're now back at work. There was 35,000 jobs coming back online. And let me just explain that for just a second for folks who don't understand why they weren't counted. So a big strike can lower the payroll job numbers because those workers are not being paid. They're not getting a paycheck. But it doesn't raise unemployment much because those workers technically have jobs, but they're not being paid for those jobs. So they're not reflected in the unemployment numbers. But when those jobs are added back, then the numbers change. So the labor market can look weaker in one report and stable in another at the exact same time. Put it this way. Striking workers aren't counted as unemployed because they have jobs and they're just fighting over them. So think about that. Put that away for the next time there's a strike. Right? Now, here's why this is interesting in this jobs report. And you're going to get this nowhere else but here, right? Because you have to connect two things. You have to connect three things to make the story make sense. A big chunk of this jobs report, 76,000 jobs, came from the healthcare sector. One of the biggest investors in healthcare in the United States is the government, state, local, federal government. Let me be more specific. Medicare, Medicaid, state and federal healthcare spending, right? So that's grandma, grandpa who are disabled, people who have children in school, who might be, who have an IEP or individualized education plan. Those are part of healthcare spending. That's a lot of healthcare spending. Most folks who are staying in the hospital for long periods of time, hell, even for short periods of time, a lot of that is paid for by the state government or by the federal government. So some of the strong growth, healthcare growth that we're seeing today, right? Why we are seeing these good job numbers, where these jobs were added, is an industry that as we get into the summer months, as we get into next year, are actually going to see huge cuts. Remember that one big beautiful bill and the tax cuts to millionaires and billionaires? Well, they had to pay for that. How they paid for it was by making cuts to Medicaid. Remember that part? They didn't really like to talk about it, but they made cuts to Medicaid. Republicans said that these cuts were to get rid of fraud, waste, and abuse. Sure, you could say what you want. A cut is a cut is a cut. It doesn't matter why you cut it. It doesn't matter how you cut it. The fact is, you cut it. Many states across this country, their legislatures have to figure out, how will we plug the hole of money that we were once expecting from the federal government that went to fund healthcare? Now, for some states, Maryland, New York, Illinois, they said we'll cover the bill. We'll cover it. We'll cover it. And so some states won't be affected. Other states said, hey, there's going to be a hole, so be it. Now, here's how that trickles down. That will trickle down to hospitals, to birthing centers, to primary care physicians' offices, to urgent care centers, who would bill Medicaid for the care that a lot of poor people across America receive. In the One Big Beautiful Bill, Republicans also put in place what one would call a work requirement to get Medicaid. Somebody has to enforce that. States will have to enforce these things. That means folks will be kicked off the Medicaid rolls, which means they will no longer get health care. If they no longer get health care, states and hospitals will no longer be able to bill for those dollars, meaning they won't be able to hire because they won't get money for that. Meaning this will have a direct impact on who they're able to hire. That means hospitals and clinics could slow hiring. Support roles, home health aides, techs, admins could lose their jobs. Rural hospitals, right? Some of the safety nets, closures. And we're already seeing these closures starting to happen. If you follow me, you should. If you don't, you should. Follow me on Instagram at Richard A. Fowler. Go to my Forbes page, Forbes.com/Richard A. Fowler. And I've already started reporting about this, where we've seen hospitals across this country start to make these cuts ahead of the big boondoggle of Medicaid cuts to come. For example, Jackson Memorial Hospital, Florida, right? Jackson South, which is one of their satellite campuses, have already closed their maternity ward. Maternity wards are very expensive. That's another video for another day. They've closed their maternity ward. That maternity ward was responsible for 500 births each and every year. Those are people's jobs. Those folks have to find jobs elsewhere. That's probably 100 jobs. Had to find jobs elsewhere, and including support staff. So as we're seeing this jobs report that many Republicans are celebrating, saying, ooh, jobs added. If 76,000 of those jobs come from the healthcare sector, a sector that you guys have cut, right? Because you've taken people off healthcare rolls by not extending the Affordable Care Act subsidy, and you've cut Medicaid, and you've cut SNAP benefits. So you've made it harder for this sector to continue to add jobs. What the hell do you think is going to happen in the sector where you're adding the jobs? More jobs are going to get cut. So the job growth. So now let's keep moving forward. So here's what you got. You got job growth is slowing this year versus last year, right? You have wages in this report also cooling, right? And you see a rise in multiple job holders. Sectors are seeing mixed gains. It's easier to find a job, but it's not necessarily a good job. So you're seeing a lot of jobs being added in low wage places, right? Home health aid, not registered nursing jobs, but home health aid jobs, right? You're seeing jobs at the Wawa and not jobs at Amazon, not jobs at Google. As I speak, Oracle laid off a couple thousand people in this jobs report. And while all this is going on, right, so you're seeing lower wage jobs added, more lower wage job openings, you're also seeing the cost of everything go up. I'm doing a video on that later this week. Pay attention to that one, right? So wages are not outpacing the real expenses that people are paying. People are working more to stay even. So people are working one or two jobs. They're working a real job and they're working in the gig economy. We've seen stories about this, about like TSA workers going to work at Uber to make this all work. And we're seeing cuts that have to come down the line. So this might be a good jobs report today, but it could signal pain tomorrow. This is a strong job market, but not one that makes people feel secure because everything I just said, right? So the numbers look good, but you're not feeling good. Your stomach feels queasy. And for the past 9 minutes and 35 seconds, I told you why your stomach feels queasy. So you're not crazy. Your stomach feels queasy for a reason. And the queasiness in your stomach is a real thing. So to all the folks who got a job this month, bravo. To all the folks looking for work and you're in the middle class. I did a whole video last week about Black women losing their jobs, right? If you're one of this is some real stuff. This is some real stuff. It's that upper middle class worker that lost their job as a result of Doge. The reality that your job is going to come back at that same wage level. These job reports aren't pointing to that, and that should scare you, and that should scare everybody. So once again, strong job market, but not one that makes you feel any more secure. I'm Richard Fowler, and as always, we're just keeping them honest. I'll see you next time.